I think I probably want to start with a general comment that most of us recognise that the design of our ED has developed over the years since 1961 when it was first opened, and even before the pandemic, we knew that the layout and the design wasn't necessarily supporting us in delivering the most efficient and effective care that we could. And I think the pandemic has really shone a light on that. And having said that, I think actually through the ingenuity and the commitment and the ability to work very rapidly, the staff actually did an incredibly good job of creating red-green areas and working in a very difficult space. But having said that, like almost every other emergency department in the country, it was recognised that most of the NHS emergency departments were never built to with the pandemic in mind, and there was a real need to increase our capability and certainly our flexibility for managing patients, particularly who needed to be isolated. And I think we've recognised that as well as really needing to do some work to release the ambulance bay for its real intention, there was also a need to improve our ability to place patients in a side room more appropriately, rather than waiting in a waiting room or having to continually prioritise who got the side room. And I think that view has really driven much of what we're trying to do throughout the whole emergency department. But in terms of the Resus, you can probably see that the layout hasn't really changed. I guess the most obvious change is going to be that our cubicles are being converted into single patient rooms. They will have sliding glazed doors, exactly the same as those in Papworth. So I'm sure many of you have seen pictures of those. And I think whilst we might not be used to working in a department where the number of single patient rooms is very rapidly going to increase, I think we know from the evidence that single patient rooms will support us in placing patients more quickly when they need to be isolated. We know that it improves patient well-being, particularly around privacy, but also it reduces the level of the noise. And I think for us as staff working in these areas, we will notice how rapidly the noise level will drop. So there's a number of additional benefits to these rooms. Each of the rooms will be negative pressure, so that they could take red or green patients. And in planning the rooms, we have tested the ability to get a bed in and out, which, as you all know, is in some ways sort of normalizing the abnormal, but we live in the world we do. And so we wanted to check to make sure that we could get beds in and out. And we can do that for 4, 3, 2 and 1. It will be difficult for 7 and 6. And likewise, we've tested it with bariatric dimensions. And again, the cubicles on the left of the diagram will be the ones that can take a bariatric bed. In addition, based on some of the feedback we got, we've put in an additional sliding door between bay 1 and 2, so that if required, that can become a much bigger trauma room. I think that's particularly important if you've got things like cardiothoracic trauma or obstetric trauma, where you'll need multiple teams and perhaps multiple patients. I can't really think of much else to say there. I think it'll improve our infection control. As I've said, it will create an environment that's much quieter, which we all know will impact on our ability to think straight, and is a much nicer environment for us and our patients. But as I said, the layout, other than the sliding doors and the negative pressure, really is not altered.